In this procedure, you will learn how to position and drape the patient for examinations of the abdomen, heart, and breasts in the horizontal recumbent or supine position, and exams of the rectal, vaginal, and perineal areas in the dorsal recumbent position. Greet and introduce yourself to the patient.
Good morning, Jennifer. I'm Julie, Dr. Anderson's medical assistant. Before we get started, can I get your name and date of birth?
Sure. Jennifer Jansen, June 23rd.
Then confirm the patient's identity using her name and date of birth.
Great.
Sanitize your hands.
So have you had a gynecology exam before?
Oh yes, last year.
Determine whether the patient understands the procedure. If the patient does not, explain what to expect.
So you know that you will have to have a gown on for this exam?
Give the patient a gown. Explain what clothing must be removed for the particular examination being done, and whether the gown should be open in the front or the back.
So that means you're going to need to take off all your clothes and put the gown on with the opening in the front.
For the horizontal recumbent position, the gown should be open in the front. Provide assistance as needed.
Sounds good.
Great. I'll give you some privacy.
Thanks.
Give the patient privacy while changing. Knock on the examination room door before re-entering to make sure the patient has completed undressing and gowning.
I'm ready. Come in.
How are you doing today, Jennifer?
Good, thanks.
Do not place the patient in the necessary positions until the provider is ready for that part of the examination.
We are going to try to make this exam as comfortable for you as possible. Julie, we're ready to begin. All right.
Pull out the table extension to support the patient's legs. For the horizontal recumbent or supine position, help the patient lie flat on the table with her face upward. Drape the patient from her nipple line to her feet. For the dorsal recumbent position, have the patient lie flat on her back and flex her knees so that her feet are flat on the table. If needed, help the patient move down toward the foot of the table for the examination. Drape the patient diagonally with the point of the drape between her feet. After the examination has been completed, assist the patient as needed to get off the table and get dressed.
Okay, do you need any help getting off the table or getting dressed?
No, I think I'll be fine.
All right, I'll give you some privacy.
Before cleaning the exam table, put on a pair of disposable gloves. Dispose of used examination table paper according to facility policies. To prevent the transmission of pathogens from one patient to another, use disinfectant wipes to clean the exam table and all potentially contaminated surfaces. Then dispose of your used gloves. Once the exam table is dry, pull clean paper over it. When you're finished, sanitize your hands. Follow up with the provider's orders regarding scheduling of diagnostic studies, collection of specimens, and/or scheduling of future appointments.